Nilipata mtoto due to peer pressure.
Sikuwa na ufahamu, kulikuwa na family planning. So nilikuwa na sex, kapata boy.
In Kenya, adolescence and young adulthood are critical periods in a person's life, filled with both promises and challenges.
I got my baby when I was 19 years old. Na hiyo ilinifanya ni drop shule. I had lost hope.
But for many young people, particularly young women, navigating sexual and reproductive health can be daunting, leaving them vulnerable to early pregnancies, unsafe deliveries, and a lack of opportunities for education and economic independence.
Adolescents are facing triple threat. Triple threat meaning teenage pregnancy, gender-based violence, and HIV/AIDS.
From the society you are coming from, there are those myths and misconceptions about family planning commodities, which is part of reproductive health.
So for example, if they come to the health facility and they are mixed with elderly mothers, they're usually stigmatized by the elderly people that they have started having babies early enough, and that, for example, was scaring them off coming to the facility. Clinic mapema. Unajua importance ya kuja kwa facility mapema.
In the Lake Victoria region, a groundbreaking initiative is helping to change the narrative. The USAID-funded Breakthrough Action Kenya project is empowering adolescents and youth by addressing sexual and reproductive health issues in a way that is community-centered, empathetic, and transformative.
Our objective is really to support social behavior change initiatives in Kenya, especially targeting malaria, adolescent reproductive health, nutrition, and menstrual health and hygiene.
Breakthrough Action prioritized adolescents and youth sexual reproductive health because of issues affecting adolescents and youth. One of them is the runaway HIV infections in Kenya, and more so in counties which are termed as high prevalent counties. That is Homa Bay County, Vihiga County, and other counties.
Enter Breakthrough Action's innovative solution, the Binti Shujaa program. The word Binti Shujaa means my sister's keeper in Swahili, and the program was designed to empower young women by giving them access to the care, education, and resources they need to thrive.
Na walikuwa wanatafuta wasichana kuanzia miaka 18 to 24. Na nilifall under that category. Another thing pia walikuwa wana consider either ukue na mtoto below 2 years ama ukue na mimba. Mimi nilikuwa na mtoto, alikuwa below 2 years, na nilikuwa within that age bracket, ndio maana nikachaguliwa.
CHP came to me and told me there was an organization that was enrolling young mothers to become Binti Shujaas. So the CHP took me to the CHA, and my name was registered, and I was taken to Kakamega for training.
We support them to work with the ministry to look for the adolescents who are pregnant and with babies, and then they form cohorts. These cohorts are called the Bintis. So they are linked with the health facility for assessment for ANC. They are linked to the facility so that if they're pregnant, they deliver in the facility and so forth. And also supported to access family planning so that they don't get pregnant again when they don't want. They are also linked with other health determinants, including going back to school, economic strengthening, gender-based violence, psychosocial support, and also pairing them with the community health volunteers for continuous monitoring and support at the community level.
When we were trained, we came back to the community and started recruiting Bintis. The first week, I recruited 15 Bintis, that is 19 years and below. So far, I have a group of 25 teenage mothers.
We do all those we want to get HIV.
Breakthrough Action also identified and trained youth champions, trusted community members who are equipped with the knowledge to advocate for sexual and reproductive health.
As a champion, my role in the community is to mobilize, sensitize, and to advocate for behavioral change among the adolescents.
The first time we joined Breakthrough Action, tulipata training ya 1 week yenye imetusaidia sana. Vile vile tukiendeleza pia tumekuwa na refresher trainings zenye zimekuwa zikitusaidia, zinatu impact more knowledge so that when we go to the community we have the enough knowledge to give to the youths.
So we have the youth champion, which targets all the young people, regardless of whether male or female. They educate them and then they refer them for various health issues.
Vijana wengi wanapenda football, so tukileta football hivi wanakuja kwa wingi, and through football, kwa kutangaza tunatangaza information na hata services zinakuwa offered. So unapata through that we reach many youths in the community.
We work at the community and want them to really take charge of their health behaviors. So we work with them through intervention called community engagement or community action cycle, where we work with them, build their agency to identify the problems, identify solutions, monitor the solutions, and actually implement those activities.
Under short-term method kuna hiyo pills. Tukiconduct sessions, nilikuwa natumikia administration, naenda na waambia siku fulani nitakuwa tuseme na inreach ama na outreach, na waambia venue na time, na waambia age bracket, tuna meet pad fulani, na kama ni hiyo morning hours tutapata youths wengi sana.
Tumekuwa pia nikitumia religious leaders wenye we coordinate with them. Unapata through services on Sundays, they also give us some youths.
From the trainings, we've also been able to see the healthcare providers and even the youth champions reach out to adolescents in forums, including schools, and other sessions just in the community where they meet out and chat with the young people and also give services.
The project helped to foster an environment where young people felt safe to learn, discuss, and take charge of their sexual and reproductive health.
Breakthrough, we integrated the services with them. Before, we could have different clinics, seeing different people. But after they trained the healthcare providers, we integrated the services together so that it can be friendly services. Our youth can come, even if they come to outpatient clinic, all the services they needed, they will get them there.
Our uptake in SP, that is IPTPT, was very low. But Breakthrough came in very strongly. That helped us so that we uplifted our uptake in IPTPT. For example, we made sure that we bought a dispenser to give clean water. And also we made sure we had a diary and also supported us with credit to call our mothers. That made us to improve until we had trophies. We have 2 trophies, being the best facility in IPTPT uptake.
Just want to emphasize what you are saying. We were able to do what we call whole site orientation. Whole site orientation means that everyone from the watchman, the gatekeeper, to the cleaner, they are aware of the challenges of the young people, they are aware of what young people need, and they are able to welcome in the facility without a challenge and without a problem.
I visited Makongeni Health Center, and one of the services that I needed was under contraceptives. So the healthcare provider who was there was very calm and very, very kind. She briefed me about different contraceptives.
This is what we want. We want to break through the norm and to try and actually make an impact for young people through the adolescent sexual health, the Binti Shujaa and the youth champions. We have made breakthroughs that way.
Habari yako? Karibu kiti.
They have got now courage and confidence to just walk inside and take condom, just come and tell you that, Frank, I need services, I need you to link me with someone who can test HIV. I just need to test HIV.
It has really improved to our uptake of NC. Another thing, the youth are now up with contraception to avoid those pregnancies. And we also talk about abstinence.
As when Breakthrough came in, we had the high number of teenage pregnancies, above 30. And right now, as we speak, we've seen a decrease.
In terms of gender-based violence, there are cases where through supporting the county and sub-county GBV coordination groups, they were able to identify some of the perpetrators who were arrested and the cases track to the end, and the guys who have been jailed for more than 20 years because of defilement and rape cases in Homa Bay County and Vihiga County.
The Aysrh Action Plan 2022-2027 that is currently being implemented, we got a lot of support from Breakthrough in terms of technical input and also financial support.
Through this holistic approach, Breakthrough Action Kenya has helped young women break cycles of poverty and ill health, leading to healthier, more empowered futures.
Wale ambao hawana ule uwezo nimewa encourage, kuna businesses wanafanya hadi tumeform chama, wengine wamepanda mboga.
I'm a mother of 3 na I earn a living from hiyo kupanda mboga. Nikiuza nalipa fee, napata vitu za watoto ndogo ndogo kama diapers.
In the Lake Victoria region, a new generation of young women is emerging, empowered, educated, and in control of their futures. Thanks to Breakthrough Action's approach to adolescent and youth sexual and reproductive health, they are no longer constrained by the challenges they once faced, but are instead shaping a brighter tomorrow for themselves and their communities.
You'll find them in our villages, some places that even ourselves may not have gone.
And I wished they would have stayed longer if they had resources to do that.
We have plans for actually sustainability, like HPAC, the Health Promotion Action Committees, right from the county level. And we appreciate the efforts, the support that we have gotten from Breakthrough Action.
Certificate after 1 month, sindio? Wapi? Vihiga.
The work Breakthrough Action has done towards social behavior change has involved strengthening the country's national health systems. And the idea behind this was to inculcate and institutionalize the good practices to ensure that they are also documented, that capacity is built, that health workers are equipped with the skills and knowledge to continue to scale up these good and noble innovations that Breakthrough Action has introduced.
We've learned about resource mobilization, but more important is the application of the behavior change communication strategies at the counties where we've been working, bringing change in terms of capacity building and also helping people to start changing their behaviors. The impact will be seen.
Ni kusema tu asante, ningehimiza binti shujaa wenzangu, Breakthrough ikienda tusiachie hapo.
This is just the beginning. With continued support, training, and community engagement, the next chapter for these young women is one of hope, opportunity, and change.